to all. On behalf of organizing committee, I welcome you all the one-day international level online lecture workshop on the impact of lifestyle on bone health, understanding and prevention, organized by FTP Division of ACT Academy, Kerala. I warm welcome to the today's resource person, Dr. Achudan David sir, a research scientist in Mayo Clinic, Minnesota, United States of America. Sir completed UG and PG chemistry in Ramakrishna Mission Vidyalaya College, Coimbatore, and completed his PhD in Taiwan University. His expertise in some areas are rheumatoid arthritis, osteoarthritis, osteoporosis, bone molecular biology, cancer molecular biology, angiogenesis, adipocytokines, bone metastasis, microRNA and INC-RNA, nanobiotechnology, pharmacology, drug development and food biochemistry, traditional medicine, and natural components. In publication part, he published 9 papers and he attended 6 national and international conferences. And are honored with several awards. They are a well-behaved student award from Vivekananda College in Madurai, Young Scientist Award in Science at the State Level Science Exhibition, Outstanding Research Award in Jan 2020 China Medical University, Outstanding Research Award in Jan 2021 China Medical University, 2021 CMU Whitestone Award in Jan 2021 China Medical University, Outstanding Doctoral Students Liajin Award in China Medical University, and Appreciation Award of PhD Doctoral Degree in Biomedical Science in China Medical University. Now I invite Dr. Achudan David sir to deliver his resourceful talk. Welcome you, sir.
Thank you for the introduction. And can you help to make us a presentation view?
So please keep slide share mode, sir.
Thank you. I hope everyone see my slide right.
Yes, sir, it is visible.
Okay,
Yes,
thank
sir.
you. Okay, thank you for the introduction. And today the topic was quite interesting and complicated, which is more important in our human life, the impact of lifestyle on the bone health, understanding and prevention. And in this session, you will be learn the following contents like introduction of bone and bone diseases, and diet and nutrients and its impact in bone, and Q&A. And during my presentation, if anyone have a question, please let us the organizer know. Then I will, as soon as possible, during the presentation, I will answer side by side. Okay, and here the introduction of bone, which is we all need to know about bone. Bone from the scaffolding that hold the body of together to allow it move, and it also have stored the minerals of vital organs and also to creating the bone marrow. And in adult humans have a 206 to 213 bones approximately we have. And the right panel we have see the functions of skeletal system in human, like products internal organs and store and release the fat in bone marrow, and produce the blood cells and the store and release the minerals various like a various calcium, potassium, various minerals, and facilitate the movement of mobility and support the body. These are the some common function of skeletal system as a bone in a human body. And here we need to know the core of today's topic, the relationship between healthy lifestyles and bone health. And here we can see the heat map in various countries like China, India, Russia, US, German, and Australia. Hip fracture incidence rate and the number and the inactivity. We have seen in India almost 40 to 49 percentage have a female physical inactivity compared to some other countries like China and Russia. But while in Germany and Brazil, still they have the ratio 40 to 49 percentage. And what are the factors has been involved uh, to induce the female physical inactivity and the hip fracture number and also the incidence rate? We can see the country
Excuse me,
wise.
sir.
Yeah,
Your slide is not visible.
maybe can you check now? Still not visible.
No, sir, it's not visible.
Okay, maybe I close. Then I will
Sir, the slide is visible.
visible or not visible.
Visible.
It is not visible to me, I guess.
Ma'am, please find the ID and pin the ID, ma'am. You can't visible.
Shall I keep going or I need to restart?
Now visible, sir. Please go ahead.
Okay. And see, we can see here what are the factors has been involved to improve the or worsen the bone hip fracture. In India, we can see smoking status, alcohol consumption, and diabetes incidence and physical inactivities. We can see the physical inactivities and diabetes incidence are most common inducing factor to risk the osteoporosis as a common bone disease. And how to recover the bone diseases from the prevention to healthy to improve the healthy lifestyles. We can see the two factors which is worsen bone and which is improve the bone factors like a diet, fruits, vegetables, whole grains, fish and poultry, nuts and legumes and low fatty diet, dairy products. But in the same vice versa, we can see the soft drinks like fast food and like a meat unprocessed product and sweets and dessert and refined grains and snacks. These all factors are also one of the factor to induce the bone inactivity and in females and also is induce the physical inactive activity. So from this we can know to improve we can understand that we improve the bone or to prevent the disease we can alter the diet or we to prevent the bone from to avoid this food and we can increase the diet and fruits vegetables. It will be better solution to improve the bone mineral density. So we know from the diet or better health management or better lifestyles can improve the bone health. So from what kind of the disease are most common in human age wise, we have the some common diseases like arthritis in the form of rheumatoid arthritis and osteoarthritis. Here we can see the healthy joint, and here we can see the osteoarthritis joint, and here we can see the rheumatoid arthritis joint. Here the healthy person have a smooth cartilage, and there is no synovial inflammation or a redness or bone damage. While in the case with osteoarthritis, we can see the bone damage with in between the two knee joint have a swelling and the bone damage. And same case in the rheumatoid arthritis, we can see the swelling like a redness or the like a bulging. We have see the severe bone damage and bulging. So in this session, I'm going to focus on rheumatoid arthritis, which is most common disease or age-related disease or like a autoimmune disease in above 45 to above the age between 45 to above they have a RA. So now I'm going to briefly explain about RA. Then I have some slides about how the diet can improve the from RA to back to the healthy. So here I'm going to introduce about the rheumatoid arthritis, and here we can see the experience the pain in free feature. Healthy joint in arthritis, how the swelling and how the bone damage was here. And here in rheumatoid arthritis, a common autoimmunity disease, it affect around 1% of world population. And the major cause of rheumatoid arthritis is synovial tissue inflammation. Hereafter, I will mention rheumatoid arthritis as a RA. Please catch up. And here, what are the deformities or what are the problems after we got the RA in human? We have the severe joint damage and deformities and the loss of the function. And here we can see the how the RA progression age-wise, while by breath we have the what are the common factors has induced RA like a preclinical RA. We have the genetic and environmental factors can induce RA, and in the clinical RA we have the two factors like environment and epigenetic factors. And if the well established RA, we have the environmental epigenetic factors are still common remission and progression as well as to induce the autoantibodies induced RA. And here I have the some tissue sections. We have see the how the synovial joint in human bone, how the penis formation and synovial tissue have occupy the cartilage area to worsen the bone part. And what about the epidemiology of RA in human? We have the statistical data in 2019 18 million people have worldwide affected RA, and in 70% of people from that are 50, older than women, and 50 and they are above older in 55 years. And in almost the worldwide statistics shows that 13 million people have affected RA, and they have a severity and highly moderate RA, which will be better cost to death number and daily disability and age wise increasing the number. For example, 1992 2015 we have the disability and adjust life years has increased, and the death rate also 1990 to 2015 have high morbidity and morbidity we have in our affected people. And what are the factors or what are the ways we can identify the RA in human as a diagnostic work? We have a if we want to identify the RA in human, we have a following working record like a patient history we need and physical examination or imaging modalities like scanning and like scanning the through the plasma or blood to screen the laboratory markers like a RF factor, like which is rheumatic factor, and anti-CC blood through the blood test, and imaging like a X-ray, and erythrocyte sedimentation rate, and like a physical examination. You know, some people have RA as a genetic disease, so we can also throw the family medicinal history. And what are the markers in the laboratory they use to detect the RA, like a rheumatoid arthritis factor and anticyclic cetylated peptide and autoantibodies and ESR and CRP. These all are the factors we are elevated in while we get RA, which is compared to the normal. With these factors are high in RA affected peoples, and his some of the markers through the blood or some serum or serum through the analysis. And here also have some synovial fluid also analysis like a cell count, crystal search, and gram staining, and culture the synovial cells to final to find the accuracy of RA. And what are the pathophysiology of RA? Here we can see the what
Sir,
are the
slide
main
is not moving. Not
for
moving,
all
sir.
are
Now it's moving, sir.
still no.
Now it's moving, sir.
What about now?
Now it's okay, sir.
Okay. The pathophysiology of RA, we have the many distinct specific features has been established in RA. Like in homeostasis, we have a various cell types in RA. Like in R in established RA, we have a various cell types like blood vessels and pericyte and osteoblast and T cell and B cell and macrophages. Various cells are activated in RA. In particularly we have see the activity the synovial fibroblast. I hope everyone can see the slides now. We can see the inflammation and remodeling fibroblast, which is most important in RA, because these cells are regulate the various pro-inflammatory cytokines in the affected synovium to trigger the bone damage and accelerate the synovial tissue associated inflammation. So, what is the synovial fibroblast cells, which is I previously explained. Here, I have a little bit introduction about synovial fibroblast. Synovial fibroblast are the dominant cell type or compressing structure in synovial tissue, and it all over constitute like a 75 to 80% of cells are in human synovium, which are in three layers of cells in synovium cells, which is synovial fibroblast. And what are the factors they have induced in RA, like synovial angiogenesis, and they also activate the various immune cells, and also they promote the osteoclastogenesis, and which is induce the bone damage, and they also induce the bone degradation, cartilage bone degradation. So focus are targeting this synovial fibroblast like to improve the disease is most like a target therapy to reduce the apoptosis and reprogram cell metabolism, and various factors can help to improve the RA through targeting the synovial fibroblast. And here we can see the some samples of slides we have here how the human samples and brain samples, which is the RA cells. Here we can see the normal synovium where we have the less synovial fibroblast cells, and the cell this section we have see where there is no or there is no accumulation of synovial fibroblast here in human sample. In the mice sample we have
Sorry
any
to interrupt
problem
you, sir. Again, so again, your slides are not moving. Now it's okay, sir.
for everyone or only one the problem?
Sir, I don't know. For myself, it was not moving. That's why I
Can you
interrupted
help
you.
Sir,
Sorry.
yes, sir. Now only the slide moved.
Now it's okay. Yes, sir.
if I am presenting like this, we can't see the pictures very well. It's just it's not a presentation
But
mode,
in
right?
this, yes, but in this way, slides are moving. In presentation mode, your slides are not moving, sir. There is some problem with Google Meet. So, sir, please continue in this mode only.
Or the okay, or maybe I will start. I disconnect, then I will rejoin again. Maybe I try to provide a better slides.
Okay. Okay, sir.
What about now? What about now, you guys?
Sir,
Hmm.
now it's coming. It's coming, sir, but
It's
wait a minute.
okay, sir.
Now it's okay. Now, sir, it's okay.
Okay. And here we can see the human samples and the murine samples, how the normal synovium, there is less amount of synovial fibroblast here. As I earlier mentioned, 75 to 80% of cells were accumulated in arthritis patient. We can see here the black arrow is indicate that 75 to 80% of cells accumulated in arthritis synovium. In the same case, in while we can see in the mice sample, we have there is no synovial fibrous cells in the normal case. While in the arthritis patient, we have arthritis animal, we have too much cells accumulated in the synovial tissue. So from this, we can conclude that synovial fibroblast cells are most regulated or most important factor that can regulate the bone damage and osteoclastogenesis and angiogenesis, and it's also recruit. It also inflates the various immune cells into the bone joint. So we can see what are the function in synovial fibroblast in healthy joint and RA joint. In healthy joint, it can help to maintain the extracellular matrix, and it produce the lubricants to joint and provide the structure between synovium and joint cavity. And here we can see the picture in they produce the collagens and laminin and fibronectin. These all factors or lubricants can improve the both joint cavities. Here we can see the joint cavity. And in RA, if RA affected people, they increase the number and it roll the cartilage degradation and produce the various inflammatory cytokines and chemokines. And it also infiltrate the various immune cells into the synovium and delay the resolution of inflammation. And it also contribute to interfere the bone repair and angiogenesis, as I earlier mentioned. Here we can see the factors while in normal they have a two or three cells there in affect in RA once if is synovial fibroblasts once get activated, they are destruct the bone. With the scissor image we can see they start the dist- uh, distract the bone part and also activate the various angiogenesis factors and the inflammatory cytokines, and also activate the osteoclastogenesis through the activate the osteoblast cells. So here we can see the how the synovial fibroblast regulate the bone damage in arthritis patient and how it will work in healthy joint. And from this we can see how restoring the synovial fibroblast is a better treatment strategy to treat the arthritis. So how synovial fibroblasts regulate the inflammation? Here we can see these synovial fibroblasts regulated inflammatory cytokines like a TNF alpha, IL-1 beta, CCL2, MMP3 or MMP30 regulate the synovial inflammation, and they are interlinked between to regulate the pain. So synovial fibroblasts regulated these inflammatory pro-inflammatory cytokines can regulate the inflammation and it make a joint pain. So here we can see the panus formation, as I earlier mentioned, in healthy synovium, in arthritis synovium, like human and mice. In molecular biology, in more detail, we can see they regulate various factors compared to the healthy in RA, like a various factor metabolism, and also regulate the angiogenesis, various signaling pathways. And here we can see how the inflammatory cytokines regulate the uh, panus formation and destruct the bone. So synovial fibroblast regulated inflammatory cytokines can induce the pain and that also can lead to the bone damage. And through the various factors like cell adhesive molecules, cell to cell adhesion, and to produce the various pro-inflammatory cytokines and various signaling pathways. So from that, what are the signaling pathways are implicated in RA? Here, whereof various abnormal signaling transaction pathways are regulated multiple cytokines, and that various signaling transaction pathways can regulate the pro-inflammatory mediators. We can see here MAP kinase as, for example, ERK, JNK, and P38, and growth factors like PA3K, and we have the NF kappa B, which is the well-known transcriptor factor for inflammation and cancer. And what are the other pro-inflammatory cytokines can come out from those these things from these signaling pathways through regulating various transcriptor factor, NF kappa B stat, and we can see IL-1 beta, IL-6, and also we can see the one more important thing here. What are the drug are focusing these inflammatory factors like we can see the drug symbol here like a tofnif, fraxinif, and the FB68123. These all are the drug can focus the PA3K and P38, and these all the drug are focusing stat, and these all drug also focusing IL-1 beta, IL-6 to treat the RA. So focusing these signaling pathways, which is regulate these pro-inflammatory cytokines, and directly we also can focusing these pro-inflammatory cytokines to treat the RA. So what are the ongoing drugs are markedly available to treat the RA to focusing these pro-inflammatory cytokines? Like we have three major drugs are in widely used to treat RA, like non-steroidal anti-inflammatory drugs and corticosteroids and a disease-modifying anti-rheumatic drugs. These three are all drugs now has been used to treat RA, but they are in these three drugs have some side effects and have also have some some irrelevant findings like suggest that they also have a side effect and also very not working very well, and also partial remission also is big problem in using these drugs, also lead to the cancer and various side effect like lazy and other bone diseases. Also it lead to the kidney problems. Various problems are there, but we can see one by one. For example, DMRD, the first line therapy of RA, it inhibit the disease progression, but it also regulate the various side effect, and it will be lead to the discontinuation of treatment. And also it is not statistically 20 million people who have RA, 7 million people got failed to achieve the final partial response. So here the drugs and what are the targeting factors like DMRD and anti-cytokines and NASD. These are the drug names, and here the target IL-6, interleukin 1 beta, TNF alpha, and how what are the disadvantage, toxicity, infection, as I mentioned earlier, cancer, and infection risk, and a limited efficacy, and no changes between progression and disease. So these all are the drugs all and currently available, but these all drugs all partially work, and major of the time these drugs also induce the various disadvantages we can see from this figure. So from this we need a better drug to treat the RA without causing side effect. In this slide, I'm introducing the drug from Antrodia synonomia, which is mushroom, which is the topic to prevent the disease from the lifestyle, to improve the food or intake or diet or nutrients what we intake can help the various function like anti-tumor, antioxidants, and anti-inflammatory and hepatoproductivity. In this mushroom there has been delivered various beneficial function to inhibit the cancer and antioxidant and anti-inflammatory and hepatoproductivity. But however, the role of this mushroom in RA is not has been studied before. In my case, I have used this mushroom to study about the RA, to culture the RA synovial fibroblast cells and find the side effect and find the molecular biology to direct the pro-inflammatory cytokines expression, and use the various molecular techniques to find the molecular mechanism like signaling pathways and pro-inflammatory cytokines. And even I have used the preclinical animal model to check this drug efficacy, how it will be prevent the RA progression, or how whether it will be reverse the disease effect or not. So here the what are the common factors has been most important in RA progression like a TNF alpha, IL-1 beta, and IL-8. I have screened by the various biopsy samples from human, normal and human RA samples has been used to detect these pro-inflammatory cytokines. As I earlier mentioned, these three markers are important in RA progression. Various drug already has been focused to treat RA to targeting these pro-inflammatory cytokines. So at the same targeting factors as I used to treat through this mushroom, we can see TNF alpha, IL-1 beta, IL-8 was, as I earlier mentioned, has higher expression in RA compared to the normal. We can see the graph has shows that normal have a less level of TNF alpha, while in RA patient have a high. The same case was with happen in TNF alpha, IL-1 beta, and IL-8. And here the patient serum samples was collected and done ELISA to detect these pro-inflammatory cytokines markers in human. And we use the drug. This the drug structure, and this is the cytotoxicity. We can see there is no cytotoxicity while treat the synovial fibroblast. No, there is no adverse effect while we treating with this drug with the synovial fibroblast. Then after that, we use the human inflammatory pro-inflammatory protein array to detect how this mushroom can prevent the to inhibit the conformity cytokines expression. We can see the mark labeling here. IL-1 beta in control have high and TNF alpha less and IL-6 less. These all are the major pro-inflammatory cytokines has been inhibited while we intake the medicinal mushroom, which is through the diet and nutrients. And here the what are the markers also involved in inflammation. But while we are focusing in TNF alpha, IL-1 beta, IL-6, because these are the major factor in RA. So we can see which all the factors are in highly expressed in RA. While we using this medicinal mushroom, it will reverse, it reduce the expression of these major targetive factors of RA. And for the final conclusion, we also use the dose dependent various doses we have used like 0 to 10 micromolar concentration. We can see the around, I think, 0.3 fold. It will above from one fold to it almost inhibit the expression of this around threefold. And here the protein and some other expression molecular findings were supported how this pro-inflammatory cytokines has been inhibited like by Western blot and ELISA. And after finding this, as I earlier mentioned, this in pro-inflammatory cytokines are important, but we don't know which signaling pathways has been involved to synthesis these pro-inflammatory cytokines. In previous slide, I have mentioned MAP kinase, JAK-STAT, and NF-kappa B. And in detail, we have see here the FAC. FAC is the focal adhesion kinase, which is the most upstream signaling pathways can regulating various pro-inflammatory cytokines. And we done Western blot to detect the FAC. We can see our medicinal mushroom inhibit the FAC pathway. And here, uh, following upcoming 2 or 3 slides, I have a signaling pathways. From that, we found signaling pathway. Then we use the signaling pathway activator to reverse the effect. So just remember that the panel we I have used here angiotensin 2, which is a FAC activator. So the upcoming slides I have, for example, PP85 as a PI3K, and here have AKT, and here the AKT activator SC79, which is a pharmacologically activator has been used in various studies and cancer and even it in human clinical trial. And here we found that FACT pathways are involved, and while we intake the Asian K, which is the medicinal mushroom, to reverse the FACT activity, and the same with the PA3K, and the same with the AKT, and the same with the, which is I earlier mentioned P65 NF kappa B, which is the well-known transcriptor factor of to producing these inflammatory markers. And P65 is in this case is a downstream common transcriptor factor can regulate these pro-inflammatory markers, can also inhibited by the medicinal mushroom effect. So after finding this, we know now these pro-inflammatory cytokines are inhibited by medicinal mushroom diet and nutrients. And also we also found that various signaling pathways also can regulate these signaling pro-inflammatory cytokines also has been inhibited. So after done this, we have a be curious that whether this medicinal mushroom can prevent the synovial joint inflammation and can improve the bone damage. So we use the animal model to detect how the bone damage was recover or not. Here we done the arthritis animal model to induce the arthritis and find the micro CT and scanning images, and we have the histology. We can see the very uh, we can see in swelling in arthritis induced model, and we have the severe bone damage. Here the control group, there is no swelling, there is no power volume. Then bone structure was very smooth and there is no damage. And while we treat with drug, it recover from the disease state, and will increase the drug concentration like the mushroom concentration 30 mg, it will completely recover to the back to the normal stage. We can see the graph here. The red seems like a disease model, and the blue is the control. And here we can see the study group green, and another dose has recovered the drug CAA induction from the arthritis to back to the normal. You can see the swelling here in disease induced model, and we can see the 10 reduce partial, and while we increase the dose is almost to recover back to the control state. So from that we can conclude that this medicinal mushroom intake can prevent the disease progression by inhibiting the pro-inflammatory cytokines and inhibiting the pathways, and as well as inhibiting the joint damage and joint swelling and from recover from the bone damage. So the major important thing here, we found that the bone mineral density was less while we was induced the disease. The bone mineral density level was low compared to the control. While we intake the medicinal mushroom can prevent the bone mineral density, which is most important in very above the 45 years. Most of the people they lose the bone mineral density. So in here we can see the mice from the mushroom intake can prevent the disease condition, and also it improve the bone mineral density and bone surface and bone volume, which is the abnormal state, the bone surface and bone volume. As we can see the previous slide here, the abnormal surface and bone volume was like not quite normal, like compared to the normal. But while we use the mushroom intake, we have see the back to the control. The abnormal state which has been reversed. And here we also collect the samples from the animal model. We collect the mice samples and we done the ELISA from the blood. We have seen that these pro-inflammatory cytokines expression also reduced from the mice samples. So from this we can conclude that we have the bone mineral density, and we also bone surface and bone volume data, and the histology sections upcoming also confirm that these inflammatory cytokines can reversed by mushroom intake, which is the prevention way. Here we can see the control. There is no bone damage in the both knee joint. Here we can see the bone inflammatory cells and also the bone damage. While we treat with the intake with the mushroom, it reverse the bone like back to the normal. And these all the pro-inflammatory cytokines in by various staining like TNF alpha, IL-1 beta by IHC. Also, here we can see the various TNF alpha accumulation in synovial tissue cells. TNF alpha, IL-1 beta, IL-8. In control, there is no TNF alpha, IL-1 beta, IL-8. While we intake the mushroom, it almost uh, recover to the back the normal state. There is no TNF alpha, IL-1 beta, IL-8, which is shows that the mushroom intake can reverse the disease state to the normal. And what about the osteoporosis diet and the nutrition to prevent the bone health? Here we can see the common method of animal model to find the osteoporosis effect in animal overactive mice OVX. We use the mice OVX to treat the same mushroom. We can see the here the study group OVX, and here the control group. The study group, we almost there is no bone mineral density. We can see the almost from the control we have a zero point 0.6, and it was almost zero point 0.1, zero point 0.5 much bone mineral density was lost by OVX model. While we treat with a drug, medicinal mushroom, various concentration can reverse the effect from the OVX induced osteoporosis mice. So here the data also support that the drug not only work in RA, the drug also can prevent osteoporosis in um, mice model. And what about the osteoarthritis? We have the knee model for osteoarthritis. Here we can see some data. Here the why we use the osteoarthritis. Osteoarthritis also have a ACLT model to find the animal, uh, to study the osteoarthritis in animal. We can see the this is the probiotic probiotic bacteria can reverse the ACLT induced bone damage, and here we can see how the intake of probiotic VKT7 bacterium can reverse the bone damage from the ACLT induced to the bone damage. And these all summarize. I have a rheumatoid arthritis, and I have some key data related to the osteoporosis, and I also have some key findings related to the osteoarthritis. Now I'm in the discussion. We all know basically calcium, potassium is one of the key factors in the bone. Eat calcium rich food can improve the bone strength, and vitamin D for absorption can also help to the bone or body, and protein support to improve the bone structure. And we need to also consider some other micronutrients like magnesium, vitamin K to support the bone health, and to like a limited salt and caffeine, alcohol to prevent the calcium loss. And like other lifestyle matters like a combine good diet and exercise and avoid smoking and to better and make a strong bones. And also the do we need to start these all the prevention measures to improve the long term bone health. So from these all prevention measures or method, we have adjust the diet and personal need, and which is advice from the professional if really necessary. And here is my conclusion. In conclusion, diet and nutrients play the fundamental role in and foundational role in maintenance of bone health, which is balanced intake of essential nutrients and alongside the healthy lifestyle practice can significantly reduce the bone related disease and enhance the quality of life by ensuring the bone strength and durability. Thanks. If anyone have a question, please let me know. I will answer as
Good morning, sir.
yeah.
Sir, myself, Dr. Sindhu. I'm not related to medical field, but to physics. I'm a faculty of physics, sir. But I'm a sufferer of osteoarthritis. My age is 45. I want to know why it happens so early. Because when I consulted doctors, they said in this early age you should not be suffered from this osteoarthritis. My second question is now I diagnosed with
Okay, maybe we can finish the
because
question first, then we can go the
yes,
question second.
yes, sir.
Osteoarthritis is not a age-related disease; it's a bone decaying. It is not a age-related or autoimmune, or is not a bone mineral density disease. Your bone has been is not a genetic disease. So
Mm,
you have a maybe I would recommend you can choose the better orthopedic surgeon to surgeon the decaying part from your bone, which is I slide I already show you in the beginning the control the normal and osteoarthritis and rheumatoid arthritis.
so
If
obvious,
rheumatoid arthritis, we have a various drug to treat the arthritis, but in arthritis we have only surgery to remove the collapsed part to back to the normal,
sir,
collapsed part to the normal. Yeah,
sir, what about these alternative therapies like Ayurveda and other things?
we
Whether they are
can. Maybe I will. I, maybe I will. For example, I am not a orthopedic surgeon, but I know from my knowledge, I would recommend you. You can use some traditional medicines,
Mm,
but it will not cure. Maybe you can. It will like a pain relief, but not a permanent solution to for your bone.
okay.
If you really need a permanent solution, you should find orthopedic surgeon to make a surgery or remove the ACLT.
Okay, so actually,
Yeah,
when I consulted, then it is recommended that this much early age you should not go for surgery. So you should be on preventive medicine. So I'm taking, but
but preventing medicine is only for pain relief. But otherwise, you feel it's not a permanent solution.
yes.
Yeah.
Okay, so
If you
what
really
is
need a
food?
permanent solution, you can find you should reduce the body weight and maybe better diet and other nutrition food you should intake and try to avoid some fast food like some other factors.
For those I'm not taking this. Sir, you mentioned in your slide that medicinal mushroom,
Yeah,
whether it is available in market or it is
is
genuine
available.
for.
Is available in market, but it is common in not in India. But we can found that in market. Maybe they have now. Now after finding, we are finding this. They now is in market, but I don't know how it will be. The transport, I don't know how they send from the Asian like China or Taiwan. In Thailand, Indonesia, they have this mushroom, but I don't know what happened in the same case in India. Maybe
Okay.
you can check in internet if they have any marketing agent. They have this mushroom. They have sell this. Maybe you can try this. Maybe really it will be work. Recently, it also working for a COVID.
Okay, sir. Please, sir, mention the name in your slide.
Maybe I provide my email address. Maybe if you need a further, maybe you can email me. I will help you. Thank you.
Okay, okay, sir. Thank you, sir.
Any other question?
I hope there is no question from participant side, sir. We shall move to the end of session.
Okay, thank you.
Thank you, Dr. Rajan David, sir.
Thank you.